Hello, nice to meet you all. I hope you're doing okay and you have enjoyed your journey in Costa Rica so far. I come here on representation of Clinica Biblica. I'm not sure if you have heard about it, but Clinica Biblica is one of the two most important and high standard private hospitals in the country. I know if you decide to come and live to Costa Rica, you will have your own health insurance and coverage. But Clinica Biblica, it's a private hospital that has a lot of benefits for international payments. Actually, I run the international patient department, and we have many options, even if you live in the US or if you live in Costa Rica, not close to the hospital, but in the coast or any other place in Costa Rica, you will find good options for take care of your health or following up with your treatments. Okay, who are we? We are, as I said, Hospital Clínica Bíblica in Costa Rica is a private hospital with a long-standing presence in the country. It was founded in 1927, and it was found for two. They were doing missions, medical missions, and they came here and they just uh, built a small place, and but they have grown to be one of the most standard and best hospitals in the country, even Latin America. And we offer a lot of specialties, all the specialties you can imagine, and we have the best equipment in the country for diagnosis and for general treatment. This is very important because this is one of the two hospital accredited by the Joint Commission International. That means that the standard of surgery and service all of our specialists have, it's the same as the one you're going to get in the US. So that is why we have this program like medical tourism, where we get leads through our website or through phone or by a facilitator that lives in the US, and the patient contacts us and then they send medical records by email, or we can just call or look a way for you to send your medical records without coming to Costa Rica. We what we do is we get the case and we send it to the specific specialist, even it's orthopedic surgeon, neurosurgeon, bariatric surgeon, general surgeon. That's what most of our surgeries are. So our mission is basically to offer the best quality of service in the country, and using the best equipment, and also having the best human approach and service to our patients, not just being a medical facility, but being somebody that cares for you as a patient, as an international patient, because most of our patients come from other countries, not knowing what to expect in Costa Rica. So we try to make them feel comfortable and become their family away from home. All right. The services we have at the hospital, it's urgency and outpatient services, specialties and surgeries as cardiology, orthopedic, and maternity. Of course, laboratory, intensive care unit, radiology, surgery, whatever surgery you might need. Then we have hospitalization or inpatient services, psychiatrics, pharmacy. That's one of the most requested services in the hospital, and among many, many others. And as I was saying about the medical tourism service, we have been working with international programs for more than 12 years now. And there's like many ways to get patients, but the our main purpose is for them not to go and just get surgery. We try to get them a concierge service 24/7. We offer the service of booking transportation, booking hotels, helping our patients with nursing care every single day. If you get surgery, you go out of the hospital and you might have a nurse that comes to the hotel or your house or where you're staying, and she will visit you once a day, sending a small report to the surgeon directly, so you feel you have you're taken care of. Okay, and of course, our patient coordinators, they all speak English, so the language barrier is not something you have to worry about by being in the hospital. If you get to the hospital, we have three facilities. We have one that it's here in downtown San Jose. We have another one in Santana, and then we are gonna open another facility in the in the west. So it's going to be closer to Cartago and other cities. So whatever you are in the country, there's a facility close by. The other way we take care of our international patients, even if they lived here, if they live here in Costa Rica, is that we can help you guys apply your international insurance. We have our own company where you get with your insurance from the US, and most of the insurance companies have an agreement with Clinica Biblica. So we will help you out with all the paperwork and communication with the doctor and the insurance company to apply uh, this insurance. Okay. If you have like an insurance in the U.S., we need to make sure the plan is overseas or it is international. Um, be sure that is the deductible a copay need to pay, or advise the insurance company the new place you will be living at or will stay at. So if you don't know if your insurance covers all this or have these all characteristics, we will take care of for that for you, and we will contact the insurance and make sure and let you know in advance what are the like the benefits of your insurance. These are one of the most common health insurance that we help our patients to apply. I know Global Benefits Group. It's right now it's broke. I don't know how to say it, but it broke. So that shouldn't be there. Yeah. And the other benefit that we offer to international patients or people living here is that if you have a veteran insurance, you can now take advantage and apply that in Clinica Biblica. It's a very new thing for Clinica Biblica to work this, but if it's designed to provide specialized medical support to the military veterans and their families. There are two insurances that we can work with, and you can apply here in Costa Rica. It's the FNP, or what it's called Foreign Medical Program. This is given to the veterans that maybe had a critical injury in their service. So they will cover 100% of whatever service is connected with that illness or the consequences that the injury or the problem might deliver. So for these, if you might have an FNP, it will be covered 100%. We have an office, so the veteran just comes and lets know, okay, this is my program, and we take care of applying that to whatever medical need they have. Yes.
So is this program available for veterans who have served 20 years, or is that going to be for those who have served less than 20 years?
I think this one, it's for both are for any veteran. Yes. But this one is especially if you had like a critical condition or injury during your service. Hmm. And the other one, it's Triker. And Triker is what you need to know. It won't cover 100% of the treatments, but if there is an annual deductible of $150 for a family member. And also there's like a family per cap. I think it's higher than $3,000 now, but we need to look for the exact amount. But this is in case of hospitalization. So otherwise, you will need to pay 25% of whatever service or medical service you might have. The good thing with these, especially, is because most of the veterans have like chronic conditions and chronic medication. So they won't have to run to a pharmacy or come by the hospital to get your medication, but we will provide that. So even if you live in Atenas or Tamarindo, Guanacaste, wherever you might live, we have the program. So we will send the medication, we will send your chronic treatment, and to be is for to facilitate that. That's the mission of our hospital, to make everything easier and faster for you guys.